I'm very pleased to welcome everybody here in the room as well as online to this meeting, which has been recorded. So anyone who wishes can watch the recording, which will be made available on the public website after this afternoon. My name is Martin Hill, and I am Chair of NHS Lanarkshire Board. The purpose of this meeting is to lay out before you a formal report on what the Health Board have been doing and what we've achieved in the year which started 1st April 2022 to the 31st of March 2023. We'll also tell you how we're moving forward beyond that, and we'll give you a glimpse of where we've got to so far in our quest for continuous improvement across all of our services. I'm going to hand over in a few minutes to Professor Jan Gardner, our Chief Executive, who, together with our executive team, will take you through the details by means of a slide presentation. We're then going to address a range of questions, a range of topics which cover the questions which were submitted in advance by members of the public and members of staff. But before that, let me share a few thoughts by way of introduction. Although this is my first annual review as chair, so it's a learning curve for me. I've spent most of my working life in healthcare, so it's easy for me and for many of my colleagues to take for granted the sheer complexity of the business of planning and delivering healthcare through the NHS and through our integrated systems to a population of well over 600,000 people across Lanarkshire. Sometimes that complexity can be daunting. Patients, after all, just want a seamless experience as they journey through the system. And that complexity can get in the way of what we need to do. But we couldn't do a fraction of what we do without incredibly effective teamwork, some of which you will see today and you'll hear about as we go forward through the meeting. To deliver over 1 million outpatient appointments across the year, to have carried out 26,000 operations, admitted 48,000 day cases, 108,000 inpatients, saw 195,000 plus people at the front doors at the emergency departments, and carried out 849,000 x-rays. And then out with hospital, we administered 625,000 vaccinations, and GPs delivered over 2.4 million appointments. These are amazing achievements in themselves, but we're only too well aware of the health needs of the people of Lanarkshire and of the demands in our services that have not yet been able to be met. The limits in our capacity mean that too many patients are still having long waits for investigation or treatment, but we're doing everything we can to reduce the length of our waiting lists, albeit not as fast as we would like to. What we've been concentrating on as we've emerged from the worst effects of the COVID pandemic is the effectiveness of our health and care services and the quality of care that's delivered to our patients. All of that, of course, is dependent on two principal factors: our people, how they're trained, how they're developed, how we deploy them, how we support them, and secondly, the systems and processes that we use to enable our staff to deliver the best outcomes they can for our patients. So far as our people are concerned, we are indeed fortunate in having excellent, hard-working and kind staff who work their socks off every day, often under real pressure to serve the people of Lanarkshire. The quality and excellence of our staff are well illustrated in the annual report, which you have with you. From very specialised improvements such as same-day discharge for shoulder replacement surgery, revolutionary hearing implants, self-referral access in podiatry, a digital app to improve pre-assessment, right up to these huge system-wide innovations, including Operation Flow, which is a proactive plan to try and alleviate the service pressures and enhance patient care, and the Monklands Replacement Project, with the ambition to deliver Scotland's first fully digital and net zero carbon healthcare facility. So challenges remain, certainly, but we've much to be proud of and much more to look forward to in the months and years ahead. My heartfelt thanks go out to every member of NHS Lanarkshire staff, including our executive team, led by the Chief Executive, and to my fellow non-executive board members. It's a real team effort. So without any further ado, I'm happy to hand over to Jan for the next part of the meeting. Thank you.
Thank you very much, Chair, and good afternoon, everyone. It's absolutely lovely to be in the room with you today, and thank you so much for those of you who have come to join us, both in the room and indeed online. Also very grateful for the various questions that people have sent in and that we've aggregated over our various interactions with our staff and public over recent weeks. Over this presentation, I want to try to cover two different elements. This review covers the period from April 2022 to March 2023. It's really important, before we go into the detail of the performance in the year that was, to just pause for a moment and reflect back, because during the COVID pandemic, Lanarkshire had a 13% higher rate of infection than the Scottish average. And that caused a really significant impact for our population and indeed for our staff. And it has left a legacy which has rolled on through the year that was and continues. But from that, we're building back and growing stronger from it. Winter 2022-23 was also, I think, agreed by many as the toughest winter that the NHS has ever faced. However, our staff rose to the challenge. They did all that they possibly could to look after and provide care and compassion to the patients that we cared for. However, as I joined NHS Lanarkshire's Chief Exec in December 2022, I saw firsthand how hard it was for the patients, their families, and indeed for our staff. So the two parts of our presentation today are, first of all, I will take you through the high-level performance measurements of the last year. And of course, on your seat, you also have a copy of our annual report. We'll give you a flavour of some of the innovative work that we're doing to transform and to recover and improve the challenges that we've been facing. And also in the second part, then joined by my executive colleagues today, we'll seek to answer some of the questions that have been posed by you. But first of all, if I can step back into the context of Lanarkshire. Lanarkshire is the third largest board in Scotland. We serve a population of almost 700,000. That's across 2,000 square miles, and it goes from Kilsyth in the north to Lead Hills in the south, quite a significant area of rural and urban. It's important to note that within that vast area, the scope and scale of the services that we provide is really significant to some of Scotland's most deprived areas. In fact, Lanarkshire, unfortunately, has over 50% of our population living in deprived areas. And as you can see from this table, it's picking out just a few areas, that some of the areas in, for example, Airdrie, Coatbridge, Bells Hill, Motherwell have almost 40% of the population and the residents living in some of the most deprived areas. We also know that living in deprived areas can impact adversely on their health and outcomes. And so that means that the services that people need and the complexity of those needs are different. We also know that the COVID impact on populations in more deprived areas was more significant. And again, the legacy and the long-term effects are not yet fully known, but we certainly believe that we're experiencing some of that. If we look forward, our population changes are coming. Actually, the growth in Lanarkshire isn't that significant over the next 7 to 10 years, but what is changing is the age of that population. Within the next 7 years, there'll be almost 25% of the people who are over the age of 75, and there'll be about a 10% reduction in the age of the young people of under 15, our workforce and our hope of the future. So with that as a backdrop, I'm going to speak more about the provision of direct healthcare, but we also have this broader role as an anchor organisation. The term that we use for the parts of, not the direct healthcare, but the part that we play as an employer and as a partner in this area, to try to improve the opportunities for people, to improve the health of our population, and to improve our economic opportunities. Again, as part of the raising some of the poverty issues that are there today. For the population that we serve, the scale and scope, as I said, is really significant, and we employ almost 14,000 people to do so. We have in our community 99 opticians, 105 community pharmacies, and 139 dental practices, offering really vital services to keep people well in our community. We also have 3 acute university hospitals, Wishaw, Monklands and Here Myers. Each one of those offers a comprehensive range of emergency services, planned care and intensive care, as well as the specialist services that I've tried to highlight on the right of the screen here that are specialist to each of the different sites. So for example, in University Hospital Wishaw, we have neonates, maternity, paediatrics and trauma. In Monklands, we have haematology, infectious diseases and renal dialysis. And in University Hospital Here Myers, orthopaedics, ophthalmology and regional vascular services. In total, across these 3 sites, we see almost 200,000 ED attendances a year. And across our 20 operating theatres, we carry out almost 17,000 procedures. And again, provide almost 1 million outpatient appointments. We also have 12 community hospitals, and if you look at the bed numbers here, you can see that it's almost the same size as another hospital. It's a really effective way of our communities receiving care across care of the elderly, rehabilitation and mental health patients. And it plays a really vital role, but it will all be part of the reform in our way forward in terms of looking at the best places for people to be cared for and the type of care that we provide. We have 94 GP practices, and I will come on to a lot more detail in and around our GP practices because we know that this is an area of concern for some of you in terms of the access to those services. But it is worth noting that the GPs who serve this population carry out almost 2.5 million appointments a year. A really high level, when we look across Scotland, we know that they are working very hard to do the very best for the communities they serve. I also share this slide to show the difference in Lanarkshire. This is part of our story, and it'll also be part of the starting point for how we move forward. We have a greater number of patients per GP than anywhere else in Scotland. In fact, what this graph shows, the blue bars represent the number of patients by different boards for each GP, and the orange bars show the number of patients from the most deprived areas per GP. What we can see from this is that relative to the Scottish average, we have 30% higher number of patients per GP than the Scottish average, and we have almost 70% higher number of patients per GP from the poorest areas. And that is, of course, of great significance, given the fact, as I said a moment ago, that people from deprived areas tend to have greater health needs. So this is a starting point, and my colleague will speak in more detail about how we're focused to try to address these as we build forward, but not an easy fix and something that we'll plan across the years ahead. As you've maybe seen from our annual report, we review our performance across 4 key areas, and these are targets that are set by Scottish Government. They're across our performance, our finance, our quality and safety, and indeed our workforce. You can see here some of the hard facts about the performance and some of the real challenges that we had through the year 22-23. I am really delighted to know that in many of these areas we've already started to see quite significant improvement, but it was a really difficult year to try to get the capacity back to manage the demand that we were seeing, but people were working hard and making very real progress. We are making changes to our services. We're doing that in terms of our pathways. And again, colleagues will speak in more detail about some of the specifics to give you those examples. But we have also been developing our facilities, such as CAMS at Udston and the Emergency Department at Wishaw, to expand the service. And we're also, as we go into this winter, looking to significantly increase our staff from investment linked to Operation Flow, again, that you'll hear more of. We set out at the very beginning of 2023, just trying to pull out of that incredibly difficult winter period, a 3-phase transformation programme. We call it Operation Flow because it's all about getting easier access to our system, moving through more effectively through our system and onward home again. We began that phase 1 in February, March of 2023, and that was to stabilise the system, to lift us up and out of that very challenging winter pressure. Phase 2 has built on the very significant learning that came from that time. And again, my colleague will go on to describe in more detail that work and the impact that it has had as we go into this winter. And phase 3, to give you a sense of the future to come, will move us into a reform period as part of our broader Our Health Together strategy to look at how we build forward to meet sustainably the needs of our population within a challenging financial landscape. That leads us to the financial position. So as a large healthcare system, we have a significant budget. The spend for 22-23 was almost 1.9 billion. And however, with rising costs, that was under pressure and remains under pressure through this year and onward. The main areas of pressure are around our staff, where we spend the most money, as you can see from this pie chart, around staff, medicine, supplies and payment to other healthcare providers. But due to the diligence of our staff and to many in this room, I'm really delighted that we were able to break even at the end of 2022-23, when many other boards around us were unable to do so. And that was due in great deal to the work to contain those costs and to manage our system effectively. However, this is becoming increasingly more challenging through this year and as we go forward. And we are really focused in the next steps in terms of that value, making sure we're doing the best with the money that we have, looking to reduce our agency and locum costs, although again, colleagues will speak about why that has been so necessary to use agency and locums, to try to deal with the system demand to get people to the right place at the right time, and to look at our medicines and supply costs as we move forward. We have also been focused on quality and safety because, of course, that sits at the very heart of everything that we do, wrapped around every single patient that we see. And this year, we've been absolutely delighted to launch a really impressive quality strategy, which has been commended by many, both inside and outside this board. We're using data to make sure that we keep moving forward and we constantly have that improvement focus, and that everything that we do comes back to our patient, the impact on them directly and on their lives, and the impact for them going forward. We look to listen to our patients and evolve. We look to improve the services that we have, and where there are challenges, we seek to understand. Patient experience is absolutely paramount, and we aspire that every episode of care provides high quality care with kindness and compassion. However, we do our best every day to get that right, but sometimes things go wrong. And when that happens, we are open and transparent, and we seek to investigate, to listen and to learn. We also listen to the feedback of our patients, and we try to evolve our services. And I hope that many of you who have given feedback into our service will recognise your voices in some of the choices that we make. And then finally, into our workforce. NHS Lanarkshire and Lanarkshire Health and Care System is all about our staff. That's what makes the people make the services that we provide. Their commitment and their professionalism is outstanding. As I said already, we employ almost 14,000 staff, 50% of them nurses, 9% allied health professionals, and 7% medical and dental. We, like others in healthcare, have got really serious workforce challenges, and again, you'll be hearing more about that as we go forward. And we're doing all that we can to optimise the skills and the skill mix in amongst our staff. We want our staff to feel valued and see Lanarkshire as a good and indeed a great place to work, but we always have to be really alive to their needs, the challenges that are around us, and to try to look after their health and well-being and to promote recruitment and retention wherever possible. We also work closely with our employee director and trade unions, and we really value their contribution in bringing the voices of our staff together and finding the best way forward. And again, you'll be hearing more from our employee director in due course. While 22-23 has been a really challenging year, we have achieved a great deal, and Chair has already shared a number of those points. And these are just a few examples. Operation Flow is an enormously ambitious programme of work to really redesign all that we offer. Monkland's replacement programme has progressed, and again, you'll hear more about that. We've had great developments in some of our clinical services, including orthopaedics, a new digital strategy, a new quality strategy, and we've also had UNICEF baby-friendly accreditation, which is so incredibly important, again, as we look to our babies, the way forward for our future. That's really the main part I wanted to cover, but before I pass back to Chair to then start to, with my colleagues, look at the questions, I wanted to say thank you. I'm really privileged to be Chief Executive here in NHS Lanarkshire, where I began my own career as a pharmacist many, many years ago. But I'm most privileged because of the outstanding people that I work with. The professionalism, the commitment, the kindness and compassion, the way that people look after our patients and indeed are thoughtful and considerate to one another. This is a really fantastic place to work, but we have a lot to do. And it has taken some real hits through the COVID pandemic, but we have real opportunity to now build forward. So my thanks to my executive team and to all of our staff for everything that we've achieved in the face of very real adversity. Thank you. Yeah.
Thanks very much, Jan. There was a lot in that, and hopefully you've found it of interest, and this builds on this whole point about the complexity of the systems we're working on. We're going to take the questions that have been posted from members of the public and the staff now. The first section is where we've aggregated a number of questions, and they were dealing with A&E waiting times. What are we doing to improve access to hospital unscheduled care, and about minor injuries units, including specifically at Keller Hospital Biggar, the reopening. So there's a number of points in there. And I'm going to invite Colin Lauder, our Director of Planning and Performance, to talk to these questions. Colin.
Thank you, Chair. So clearly the question of unscheduled care is in forefront of many people's minds, having seen and experienced indeed poor levels of performance, not only here in Lanarkshire, but across the whole country, the whole UK over the last winter in particular. We agreed that we as a system would not accept that level of performance, and therefore at the back end of last Christmas we resolved to create Operation Flow. It's an acronym. F is for focused, the L is for Lanarkshire, i.e. the whole population. The O is for optimal, which means that we learn what the optimal service model would be, and the W is for whole system, i.e. it's a partnership. And the principal partnership is between not just the Health Board and the Health and Social Care Partnerships, but also the Scottish Ambulance Service, who are crucial participants in that. So I'd like to spend a few minutes just explaining the main elements of Operation Flow and what we've done and what we hope to achieve. With regard to the specific Keller question, I'll refer to Professor Sengupta, and we'll be able to describe where we are with that. So as the Chief Executive has already said, we've effectively focused our actions in terms of stabilisation, which was the work that we carried out in the spring, redesign, which is Operation Flow 2, which is the planning element that we've introduced over the course of the summer and the autumn, and reform, which is taking all of that learning and all of that experience and designing a sustainable and unscheduled care service. Underpinning all of that are two very, very important themes. One is we need to improve the patient care and patient experience through an unscheduled care. And we also need to look after our staff. COVID was a hard gig for a lot of colleagues, ourselves included, who worked through the 2 years of the pandemic and the resulting impact of COVID, and also the changes in our demographic of our population have led to a lot of pressure on our staff. We talk about the 4-hour access performance figure. That's really should be taken as a barometer. It's a barometer of a whole system under pressure, and the fact that we've not been able to achieve that is not by any means a result of any major failures in terms of the staff in the emergency department. It's about several factors, all of which combine towards that poor performance. We need to look at all elements of the patient journey. We need to reduce our hospital occupancy, reduce the pressure on our beds. We need to address the demand at the front door with regard to who requires care and where that's delivered. That includes supporting people at home, and it means, in essence, providing the right care in the right place. So this is a slightly busy diagram, which some of you may have seen before, but effectively we've got the patient journey described here, steps 1 to 5. And Operation Flow has been a major piece of effort involving hundreds of people across health and social care. And the actions that we've taken over the course of the spring, the summer and the autumn are described within each of these blocks. So the front end, a lot of emphasis with regard to providing care at home, where that care can safely be provided at home, and where not, how can we augment that care at home? And so we've got H@H hospital at home. NHS Lanarkshire are the Scotland leaders with regard to provision of hospital at home, and over the course of the year we've expanded our capacity, and we've also expanded the way in which those teams not only help people before they come to hospital, but also support discharge. That's a big one, and it's a theme which has been taken up very much across the whole of Scotland, and we are supporting the Scotland-wide development of hospital at home. There's other things that mentioned there. The teams which work in the community, not only nurses but also AHPs, how are they augmented, how are they focused, where are social care teams working within the system. One of the big elements that we've been trying to develop is the Flow Navigation Centre. Flow Navigation Centre for members of the public will become part of your understanding of how we manage healthcare. It's a concept which we've had in some elements in Lanarkshire for several years, but during the COVID pandemic, a lot of money was given to health boards in order to develop further flow navigation, and we've augmented that ourselves through Operation Flow. The idea with flow navigation comes back to that earlier point, is ensuring that we provide the right care at the right time in the right place. It's trying to make it easier for patients and their relatives to navigate through the system. It's trying to make sure that we deliver that care first time in the right place. And it involves a team, a physical team, who sit in a room in University Hospital Lanarkshire, of clinicians and administrative staff, nurses, doctors, paramedics, who take calls from general practitioners, who take calls from other colleagues, and who speaks to ambulance crews on an hourly basis, and can make a clinically informed decision with regard to what is the best care for an individual patient. We've already seen, not just in Lanarkshire, but also in other health boards across the country, that can make a big difference if you're actually directed to the right care from first contact with the health service or through your GP. The emergency department, of course, is crucial to the patient journey. We have variation within our three emergency departments. We've got nuggets of good practice in all three, but we don't necessarily have all of these nuggets all in the same place all at the same time. So a lot of our work over the course of this year, and both the previous financial year and this, is reducing that variation and improving best practice within the emergency department. And some of that has involved investment in additional staff in those departments. If patients need to be admitted, we need to make sure that patients stay for the right length of time in hospital, but not too long and not too short. And that's what we mean by flow within the inpatient environment. And those are inpatient wards within acute and also inpatient wards within community hospitals. Again, a lot of that is about reducing variation. A lot of it is about supporting members of staff working in those wards to make the right clinical decisions. Many of these people have joined NHS Lanarkshire before COVID. They're used to working in emergency mode. We need to make sure that they work in business as usual mode with regard to the way in which we make sure patients are discharged tenuously. Discharge in itself is a major element and depends heavily on families being able to look after patients when they're discharged. It falls upon our clinical and social work teams and community to be able to support. And ensuring that we discharge without that delay is an important element with regard to not only making sure that we have capacity within the system, but also to make sure that we have the right quality of patient care. And you'll see quite a number of areas whereby we're working through discharge. The last column is about data. This is a complex system, as Jan has said, and in any complex system, we have to understand fully what's happening at each stage of the patient journey, and therefore we need to understand through collecting data, which includes not just activity, but it includes outcomes and includes the quality of care that we're delivering, and being able to feed that back into our learning around it and scheduled care. The outcomes are the green boxes. We measure all of those. We're trying to make sure that we optimise all of those. It's not just about the 4-hour target. You'll see there are quite a lot of green boxes there. We need to make sure all of that works in synchronisation in order to make sure that the whole patient flow is effective. So that's just an overview of an awful lot of work which started at the start of the calendar year and is very much continuing into this winter. I'm taking one small element of that, but it's actually the emergency department. And I mentioned the complexity and variation which sits in there. You can see on the left-hand side the various ways in people and patients end up in an emergency department. We're trying to make sure that as many of those referrals go through the Flow Navigation Centre, but there is and there always will be a route for self-presenters turning up at an emergency department. We've got a big idea in the middle, which is REACT. This is about super triage. We put some clinical time into REACT. It means that within any emergency department, right care, the right time, at the right place. And you'll see we have metrics and key performance indicators throughout that whole patient journey, which we aim to finish within 4 hours and demonstrated at the bottom. I won't go through all of these boxes. To hopefully give you a good flavour with regard to how much service development has taken place within the Operation Flow arena. I've mentioned some already, Flow Navigation Centre and REACT. We've also got community services in terms of treatment rooms. And the whole ethos of this is about the whole system working. It's about improving patient care. And as we go into winter, we intend that will make a demonstrable difference with regard to the patient quality and patient experience that we and our relatives would want within NHS Lanarkshire.
Thanks very much, Colin. I know there was a specific question. Pardon?
That's the question.
Well, if you just let me finish first, and then there was a specific question asked about the minor injuries unit in the Kellow Hospital. Professor Suman Sengupta, Director of the Health and Social Care Partnership in South Lanarkshire. So, come forward.
Good afternoon. As many of you will know, at the start of the pandemic, NHS Lanarkshire took the difficult decision to spend minor injury units at the Kellow Hospital. And as we've moved through and out of the pandemic, we're unfortunately still in a position of having to pause that provision of services. The reasons for that are to do with staffing challenges, which are both apparent within Lanarkshire and challenging NHS Scotland right across the country. It's important to recognise that it has been very difficult to recruit a range of staff within that area, particularly in relation to minor injuries. And in terms of our responsibilities for providing services, it's a combination of both having enough staff and also having staff with right qualifications, as we're obliged to do so under safe staffing legislation. I would also highlight that nursing within the Mind Ranges context requires a different set of qualifications than the nurses who operate within the main unit of the Cottage Hospital have. So it's not a like-for-like comparison there. Because of those recruitment challenges, unfortunately, we're not in a position to set a timeline for when we'll be able to reopen minor injuries at Kellow Hospital. I would highlight those two elements on top of that, though, but I will provide some reassurance to local communities. Firstly, there are other supports available. There are our community treatment rooms. There's the wound clinic in particular, which is actually still based within Kellow Hospital and indeed was established when the minor injuries unit was paused, and I understand it continues to be very well used. And also, if anyone's got the minor injuries looking for advice, they should call 111 for initial assessment and then signposting on to the nearest place where they get support. And then in parallel with that, we have continued to invest in innovative arrangements within South Lanarkshire, North Lanarkshire, and indeed within the Clydesdale area to ensure that we are able to provide an appropriate range of care and support for local people, most notably in terms of the recent extension of hospital at home. Thank you.
Thank you, Subin. Just on the point about questions, what we'll do is we've got a good deal of information still to impart. I'd like to hear from our colleagues, and if at the end we've got some time, we'll take some questions. But at the moment, what we're going to do is look at the questions that we got in around waiting lists and planned and cancer care. What we're doing to improve access to planned and cancer care. And I'm going to ask Judith Hart, our Director of Food Services, to address this.
Thank you, Chair. Good afternoon, everyone. I'm Judith Hart, Director of Acute Services. So this is the other side of the house, isn't it? And just building on some of the commentary from the Chair and the Chief Executive, we do recognise that we have a lot of patients waiting for treatments that we wouldn't normally want to wait any lengthy period of time. And trying to work through this, our first priority has been looking at cancer care. So the diagram on the left of your screen shows our framework, our cancer framework. And at the centre of that is the patient. The patient is the most important thing in this. And around about all of that, with our corporate responsibility for a whole system approach, gives us our cancer framework. And just maybe highlighting a few of those steps. We have been working very hard with secondary and primary care clinicians to make sure that we've got the right patient pathways in place, so that if a patient presents with their GP and their GP has concerns or red flag symptoms, those patients could be flagged in, certainly electronically through the system, and then we pick them up at the other end and start them on a tracking pathway. And you'll see at the end that we've got active patient tracking. So this is trackers, individuals who follow up every stage of these referrals, who make sure that the patient is going to the diagnostic service at the right time, chasing up the results, and again, making sure that these patients are discussed in an MDT, and an MDT is a multidisciplinary team setting, which brings together a whole cohort of healthcare professionals to decide with the patient what is the next course of action for them as individuals. We recognise as well that we have seen a big significant increase in urology referrals as well for patients coming into the system. And again, one of the things that we're trying to do there is to develop an early hub service for patients, again, with diagnostics that come in. And again, we try to triage and treat them as early as possible. As we were talking earlier, and the Chair and the Chief Exec mentioned around the cancer standards, 95% of patients being seen within 31 days and 62 days. And whilst we've managed to maintain our 31-day delivery at 95%, we know that our 62-day performance has been challenged. And part of it is around those diagnostic areas where we're trying to manage laboratories, radiology requesting coming in for diagnostics, for patients who are inpatients, for outpatients and cancer patients. So again, we'll be looking at different ways that we can provide these services. Moving on to planned care. Again, as the Chair and the Chief Executive highlighted, we had patients obviously through the pandemic who did not go on to have elective treatment, and that was done on a clinical prioritisation basis. And what we're trying to do now is to work through all of these patients, looking particularly the ones who have had long waits, making sure that those patients are being reviewed either virtually or in clinic by the clinicians and trying to secure dates for those patients. And we've made quite a big improvement in the long wait patients for outpatients in particular. We don't want our patients waiting long periods of time to be seen. And again, trying to look at different ways to make sure that we can improve access. So is that now done through virtual, where you can do it through your iPad? Is it done in person, or is it done on the telephone? Lots of different ways that we're looking at how we do that now. We've also been looking at different ways of maximising our local capacity. And again, any of you who visited any of our hospitals will see at times we have some mobile units who help us with diagnostics, with endoscopy, located on our hospital sites as well. Again, just to try and improve access. We also send our patients who are clinically appropriate to the Golden Jubilee Hospital, and whilst that's maybe a wee bit of a distance, the feedback that we get from our patients is that the standard of care is very good, and there are a lot of orthopaedic procedures and ophthalmology procedures carried out there as well. The Golden Jubilee, working with a wider concept of Across Scotland and the Centre for Sustainable Delivery, again are areas that are looking at where we can highlight good practice. So again, for each of the specialties, they've developed something called a specialty heat map, which is something that each of the specialties in Lanarkshire is looking at areas of good practice. How do we embed all these good things that are being done on other boards so that there's a go-to place for all boards to try and take these forward. And again, you'll be aware that we're doing a lot around digital. So anyone maybe who's had pre-assessment coming forward for an operation will know that we've now got our ELSI system in place, where again, it's done electronically. Initially, we all thought we needed to call the pre-assessment nurses ELSI, but we don't. It's just around the electronic system that's in place. And the feedback from the patients has been really fantastic around that because it's interactive. And again, patients can post comments and the staff can come back to them and give them some further information. And that's something I think that's really important. And we've also been looking at, and moving towards the winter, at how do we try to protect areas of elective capacity within the hospital. So, for example, last year we knew that we struggled to maintain all of the elective orthopaedic profile beds at University Hospital here, Myers. So, working with the team, we've agreed a standard operating procedure which makes sure that those areas are protected, that any patients with certain criteria can only go into those beds. And again, we're trying to work with the team around moving more to 24-hour, 48-hour surgery, patients going home very quickly after surgery. And again, some of me have seen that we did a shoulder replacement first in Scotland, and again, the patient went home really quickly, which is great for the patients. Patients want to be in their home environments. We're also looking at how do we manage to protect our day surgery unit at Monkland. So it's a standalone facility, but again, over the winter period, can it be ring fenced so that we can maintain urology, ENT, general surgery, big procedures, big volume specialties on the Monkland site. And again, I think that gives us a way of maintaining elective activity over the winter period. We want to be able to continue to keep going with an elective programme because we know our patients are so keen for us to be able to support them in the next part of their journey. I will pause at that point. I'm ready to pass on to another colleague.
Thank you very much, Judith. I look forward to meeting Elsie. The next set of questions were around GP services and primary care, and the questions are about how we are implementing primary care improvement plans that we have in place. And I'm going to invite Susan to come back and address these. Thanks.
Thank you, Chair. So this is the slide that the Chief Executive set out earlier on. So I'm not going to repeat what she's already eloquently covered, but it is important to recognise the context within which we are operating within Lanarkshire in terms of the availability of general practitioners and indeed other staff. There is a crisis in general practice and general practitioners right across Scotland and, dare I say, the UK. And so it's important we think about how we currently deploy the current services that we have in place, and also to think about what the implications are in terms of the ambitions we have going forward. As Jan has also set out, we have significant challenges in terms of inequalities and the consequences for our local communities, for our staff and for our services. And that certainly applies to the work that's undertaken by our colleagues within general practice and indeed primary care more widely. Part, but it is only part of our approach to addressing these challenges then ties into General Medical Services Contract 2018, which set commitments for developing primary care improvement plans across all parts of Scotland. Now, within Lanarkshire, we've made, and we're recognising having made good progress in terms of our primary care improvement commitments. These are some examples of the key areas within that. In terms of the vaccine transformation plan, we've had full rollout of that programme with our preschool vaccination now delivered through a managed service by our health visiting teams, our school immunisation programme taken forward in terms of flu, HPVs, delivered by managed services in terms of our school immunisation teams, and also our vaccination programmes alongside the work we do in terms of pregnancy and travel care. We have good provision of community treatment and care services through our treatment rooms right across the Lanarkshire areas, and all GP practices across NHS Lanarkshire have been now offered the transfer of chronic disease management patients to attend treatment room services for biometrics. And to date, we've had 44 practices take that up, so that's coming over half, just coming up for over half the practices, more coming on board every week and every month in terms of that area of work. Pharmacotherapy has been a challenge for us because of national shortages in terms of pharmacists. That has been in a whole range of services that we provide both within Lanarkshire and more widely, but nonetheless, we have made positive progress there in terms of rolling out our pharmacotherapy hubs across all the localities, with 9 of the localities now out of our 10 now served by such hubs. Hubs are a centralised service which promote remote pharmacy and prescribing support to GP practices. And they can provide support to multiple practices in the locality and so provide a sustainable 5-day service, 52 weeks of the year. We are continuing to develop our work within these areas and critically thinking beyond that. As Janet said at the beginning, our ambitions for how we develop services right across go beyond just the de minimis positions here. So we are going to invest in time and effort to better understanding the needs and demands of our communities, and then looking to a refreshed model of primary care going into next year and beyond, which very much looks to amplify the opportunities of digital, to be more into areas of opportunity in terms of innovation, and to undertake a whole system redesign as part of our wider efforts, both in terms of planned care, as you've already heard, and indeed unscheduled care. So I've set out, there is a crisis for general practice right across Scotland and indeed the UK. There are 3 elements to that, which we've touched upon as themes through the course of this afternoon already, in terms of levels of demand on our system. Sustainability of practices continues to be a real challenge. We are fortunate that we don't have any directly managed practices within Lanarkshire, as is the case elsewhere within Scotland, but we can't take that for granted, and indeed that situation can certainly change very rapidly. And then importantly, patient access. We understand that many communities across Lanarkshire, patient access continues to be an area of challenge to them as we've moved out of the pandemic. We also recognise that from the data we have, our practices are very, very busy. So as we look to our priorities going forward, we are committed to working with the general practice partners, both within Lanarkshire and more widely, to firstly do whatever we can to sustain practice and GP provision within local communities. Secondly, to continue our commitment to rolling out the primary care improvement plan. And I said this specific area of work which we'll continue to take forward in terms of pharmacotherapy, but indeed in terms of other areas that have not been rigidly prescribed, for example, the development of our primary care occupational therapy service. As I said, to undertake a substantial area of work in relation to better understanding the needs and expectations of local communities, building upon the considerable consultation which has already been undertaken in respect of our Health Together strategy, which colleagues will talk about later on. And finally, to work with the Scottish Government to identify new opportunities and scope for innovation within that space that we're going to take forward in terms of next year and the year beyond, that we hope not only provides sustainable and valued services within our local populations, provides an example of what can be done right across Scotland as a whole. Thank you.
Thank you, Susan. Thanks very much for that. I shared with some of my colleagues a recent experience of my own, where I was making contact with an EP. And I have to say that the service I received from my GP, who didn't know me, by the way, was excellent and couldn't fault it. The problem was actually getting through on the call. And so there are things that we need to continue to work on to improve access, because that will discourage some people. So there are lots of things happening around primary care, and we need to see improvement going forward. The next group of questions is around mental health. And I was struck when I attended one of the community planning partnership meetings in North Lanarkshire, where we were getting feedback from the various community groups, which highlighted and prioritised mental health and well-being as a significant issue within our communities. And we know that. And that's why we need to continue to put a huge amount of effort into the way in which we serve our population around mental health and well-being. And the next group of questions are around that, about what we're doing to improve mental health services, with specific reference to autism and CAMS, but also the impact not only on the children but on carers. So I'm going to invite Professor Rob McGuffey, who's the Director of the Health and Social Care Partnership in the North and Chief Officer for the North IGP. Ross.
Thanks, Martin. So we have been working our way through our mental health strategy. We launched our mental health strategy back in 2018 as a 5-year plan that come to its completion at the end of this financial year. And we are currently doing a range of work to now start to pull together our next one. The new National Mental Health and Wellbeing Strategy has been heavily based on work that was kicked off in Lanarkshire back in 2018. And we're currently just doing a gap analysis in terms of any remaining actions from the existing strategy against the new strategy that's come out from the Scottish Government as well. And that will form our new development plan for the next 3 to 5 year period. So today I'm going to pick up a little bit on some of those services within. Pick up on the question we received previously. CAMS is an area that had a really significant impact during the pandemic, both in terms of referral rate. Urgent referral rate had a massive impact on the service. And there's been a huge amount of work done in terms of both recovery, but also in terms of rolling out the new national spec as well. So there's a new national service specification that's been pulled together for CAMS, and we've been doing a load of work in terms of the rollout of that. So we've had a whole range of innovations that have been pulled together. We've got a programme board that ran throughout the whole of 22-23, pulling this together, that looked at our longest waits, creating new referral pathways and electronic referrals for our referrers. New facilities, so we've got a new CAMS facility in South Lanarkshire that was designed by the children and young people who use the service, and those who have seen it will see it looks incredibly different to what a normal NHS facility would look like, but the feedback from both children, young people and families has been incredible off the back of that, and we're currently just doing the same work again for the 2 North facilities. So we've got a facility in Airborne Road and also at Coat Hill Hospital, and the upgrades for the same process has been done on those 2 sites, and we'll kick off this financial year and we'll complete probably early next financial year. Our performance has improved, and you can see at the end of the financial year it was sitting about 30%, but the latest figures in September show that's up to 68%. If you go back to August 22, that was really the peak of our waiting time. We had a wait list of over 2,100 people. By September, that was down under 300, and we're now ahead of trajectory and probably looking at hopefully be able to make the 90% target before the end of this financial year. So CAMS is moving forward at pace. The second tranche of referrals, recovery and renewal funding from the Scottish Government then picked up on some of the neurodevelopmental service as well. I should have said in CAMS, through that recovery and renewal funding, we've been able to increase the capacity of CAMS massively. So we started off with a whole-time equivalent establishment of about 115, and that's now at 209. And similarly, with the second tranche of funding for the neurodevelopmental service, that's allowed us to triple the workforce to 52 full-time equivalents. We have, though, seen a massive increase in terms of referral rates. We've probably cleared the first hurdle, in as much as we're averaging 62 referrals a week into the service. We now have enough capacity on the ground to meet that, so we can recurringly meet the demand that's coming in. The challenge is now going back over and reducing those waits. So that's really the next challenge. We've created one integrated service within the neuro team, so that's taking together CAMS, paediatrics, speech and language therapy, OTs, dietetics as well, all into one integrated service, so that the families don't have to navigate through a whole range of different services, just one integrated function, which is a huge step forward. And now we're really just trying our best to work through that, how we start to reduce that waiting list, and that'll be through temporary increase of capacity, so that we can try our best to over-establish the service to create extra capacity. We've got external commissioning as well, so we've commissioned Purple House, who'll do some of the autism assessments for us, and that'll take out an extra 20 a month. And we've also got a range of sort of innovations we're working on. So we've got a test of change in South Lanarkshire at Crawford Dyke Primary, where we've got 20 children and young people within the school who are waiting on assessment, and we're going to do a 2-week intensive piece of work in that school to do all 20 assessments, as well as having drop-in sessions for families, etc. as well, so we get that whole wraparound and just see the impact that we can have by doing different ways of working, and we'll build that up into the new models going forward. And also really important to pick up here that this should not impact on the universal service either, so really important to maintain the same universal provision for these children and young people while they're waiting on assessment. And we've also, through the service, got a whole range of different group supports that are now being up and running, and that's picking up on a whole range of things like sleep, sensibility, managing meltdowns, anxiety, personal care, strategies for meal times, etc., etc. So we've got a whole range of group activity now in place for those on the waiting list. In terms of adult mental health, our psychological therapy service has been another one that's gone through quite a significant range of sort of innovative developments as well. So we've got a point of change in terms of the use of digital. Obviously, the pandemic changed how we work as a service quite significantly, and things like Near Me for online consultations, but also group online activities, etc. Taking the feedback from our patients has been really positive and supported us to create quite a different way of providing the service. We still have a whole range of face-to-face, but we've also got the option of digital and class-based activities. We've done a lot of work around trying best to make sure it's not a postcode lottery. So if one locality area is struggling, we're trying best to share some of the work around long waits. And we've created a peripatetic team, just a mobile team that will basically go to the localities with the longest waits, so we can try best to tackle that and make sure there's no geographical disparity in our service. We've been doing a range of work with waiting lists. The department has now got university status as well, so we've been doing a whole range of different innovations with the universities in terms of trying best to change the way we're working. And by the end of the financial year, we had hit 86%, which is really positive in terms of that recovery. The slight note of caution, I suppose, is we've got a Public Health Scotland analyst working within the team, and their feeling is at the moment we are likely to remain in that sort of 80-85% bracket, and that's because demand is quite significantly up. The complexity of cases that we're supporting is up. And we've got quite significant challenges in terms of recruitment. So particularly consultant level recruitment across Scotland has been very, very difficult. You can see at the moment we've got 23 full-time equivalent vacancies, about 10% of our workforce. And unless we can make some real gains on that, then we're going to struggle to get from that sort of low 80s up to the 90% mark that we're obviously targeting. And finally, just a quick pick-up as well in terms of drug deaths. Through the alcohol and drug partnerships in both North Lanarkshire and South Lanarkshire, there's been a huge amount of work done around drug deaths. You can see that for 22-23, there was quite a significant improvement overall in Lanarkshire, a 23% reduction in drug death. There's still quite a shocking figure there when you see 136 drug deaths within Lanarkshire within that calendar year. The data up to date shows that decline is continuing across Lanarkshire into 23-24, which is positive. We've got a whole range of work underway, particularly around the medication-assisted treatment targets, and this is looking at how we can provide and use our medication, provide choice, same-day access, etc. for individuals in Lanarkshire so we can provide as rapid a response as we possibly can, but also do some assertive outreach to try best to make sure that we're retaining people within the service and making sure they can access that support. But again, I'll pass on.
Thank you very much, Ross. Thank you. The next question deals with an issue common across the NHS and indeed the public sector, is about how do we improve recruitment and retention within our services. What are we doing generally to improve workforce issues? I'm going to invite Jackie Jones, Director of Human Resources, who's one of our newest recruits to the Executive Director team.
Thank you very much for that, Chair. Good afternoon, everybody. Thank you. Very good to be here this afternoon. So you've heard the Chair and the Chief Executive talk about recruitment and retention in our workforce, but there are other issues as well that we need to deal with around the workforce. So I'll just try and talk through some of those. So you've heard other people say around recruitment and retention in areas where it's been really, really difficult. So we've been trying to look at international recruitment. We've had some success with international recruitment. We've looked at job fairs. We're looking at social media, which has had some impact in terms of recruitment. And we've also looked at setting up our own recruitment website, where that's had much more success in getting people to look at NHS Lanarkshire as an employer. We've also been working around the areas that we call around employability, around attracting young people into the organisation, but also looking at other groups of people who wouldn't normally see a career in the NHS and trying to get those into NHS Lanarkshire as well, because those are the people that not only help our workforce, but also help areas of health inequality and poverty in the community as well. So we've still got a lot more work to do around that, but it's been really, really positive work that we've seen so far. We do have an aspiration to be a great employer. We have our staff survey that we carry out every year. We look at the results that come in from that, and we put action plans in place right down to team level. And in HR and through our staff governance committee, we monitor those action plans and make sure that those are being delivered. So this is about listening to the staff, saying what's good for them, what's not good for them, and then trying to put action plans in place to deliver that. You'll see there our response rate, which is 58%. That's up on the previous year, but personally, I would like to see that response rate being much, much higher so that we can really, really understand about our staff experience. When you look at the actual engagement index, which tells us how staff feel around working in Lanarkshire, 78 is quite a good score, and actually would be one of the higher ones in NHS Scotland, but still we can improve on that. So how do we look after our staff in the organisation? So we have an occupational health service that provides health services to our staff. We also have wellbeing online so that our staff can access that. Our staff can self-refer to occupational health so that they can actually get some services to try and help them stay in work. It's really important that people do try and stay in work. We've developed a staff wellbeing strategy. We've got an action plan in place, and that's being delivered, and we'll monitor and see what the results are that we get back from that. I think it's really important there, although quite sad, when you see that we're celebrating a 17% reduction in staff assaults. So we've done a lot of work throughout the organisation on trying to reduce violence towards staff, and we've also done a lot of support for our own staff who may experience that. One of the other ways that we try and look after our staff is through training, learning and development. So obviously we get our staff in, we need to train some of them into the organisation and what they need to do and induct them. But also we try and develop our leaders of the future. So we have leaders who we develop now in their roles, and then we look at those that we want to develop in the future. Succession planning and talent management is really, really critical in the NHS. At all levels in the NHS, we need to try and grow more of our own staff, grow more of our own leaders, and get those up through the organisation. If you look at senior management in particular, there are some real critical vacancies there. across the whole of NHS Scotland, not just in NHS Lanarkshire. So I will now hand over to Phil. Thank you.
Jackie, thanks very much. You've heard how we're responding to specific questions that have been asked. And we've heard a lot about how we are not satisfied with where we are in a number of areas and the work we're doing to try and improve the quality and responsiveness of services. But what about the longer term? It's all very well dealing with the onslaught of demand which comes at the moment, but we've got to stand back as a health board and say, we've got a future here for NHS Lanarkshire, we've got a future for the people of Lanarkshire in terms of their health going forward. And so we need to develop our strategic planning, and we need to develop our plans that are going to be sustainable for the longer term. So a lot of work has been going into the early stages of developing our next strategic plan, and Colin Lauder is going to bring us up to date with where we are. Thank you.
And so to the future, which is exciting, but is challenging. We last set our stall out with regard to what the future looked like in 2017 when we published Achieving Excellence. If any of you are sufficiently inclined to look at Achieving Excellence, you'll find in section 7 what we set out to achieve at that point, much of which in fact we did. And it was the plan that in 2021 we would have a new forward-facing strategy for healthcare in Lanarkshire, but something got in the way of that. So we've resurrected that process, and to some extent I'm really pleased that we didn't in fact do that, because so much has changed over the last 3 years. You've heard already this afternoon where our challenges lie, and this is really where the strategy needs to address our energies going forward. We've heard about the population challenges, and we've heard about recovery from COVID. COVID is both still with us, but also the legacy of COVID will be with us for many, many years, unfortunately. We've heard today about the services and access to those services, development of those services across the range, not just hospital services, but also community and mental health. We know that we live in a financially constrained environment. It has always been thus within the NHS, but we have some particular challenges for NHS Scotland over the next few years. And that limits our ability to act. It means that we really need to focus on that, spending every pound wisely within healthcare. And we've just heard from Jackie with regard to workforce. So we are changing, or we are transforming, we are reforming our services. I've spoken about Operation Flow. Our Health Together brings all of this together, and I'll be talking about the Monkers Replacement Programme as well. In terms of how we're going about this task, the orange boxes at the top there give us the 4 themes by which we will plan: better health, better care, better value, and better workplace. Our ambitions are within the blue boxes. We want to be an exemplar and anchor organisation. We want to be a high-performing organisation. I've already used the word optimise with regard to Operation Flow, and I've mentioned already the financial balance. What we've not touched about is our climate change responsibilities. As an organisation, we produce tens of thousands of tonnes of carbon dioxide. That's happily been reducing. Over the last 10 years or so, we need to reduce it further, but that needs to be central to our endeavour, and a lot of that will be about harnessing innovation and collaborating across boundaries. We spent the spring asking people what matters. We asked our staff and we asked our public. We set out our stall through focus groups, conversations, piggybacking in meetings, online surveys, speaking to politicians, members of the public, our partner organisations and our staff. What matters to you? What does that future need to look like for you to regard NHS Lanarkshire as a successful organisation? And we had over 2,000 responses to that. It's one of the biggest responses we've ever had. Normally, you get a big response when you're proposing something controversial like closing something and people changing something dear to their hearts. We'll be talking about neonatal in a moment. But the responses about the general picture of the future were really very, very rich and are now being used in order to shape the way in which we do the plan of our health together. And I've really just very briefly summarised those in 4 areas. As we've heard already a couple of times this afternoon, access to services, and as Martin was alluding to, access to GP services came out by far the most pressing issue that we as a health board need to address. But also, as Judith has said, long waits for operations and delays in accident emergency. The patient experience was a very, very strong theme as well. People want to regard healthcare as being very personal. There's a limit to how much you can do that, given the volume of activity that we've heard described today. But nevertheless, having a personal experience is important. Here's a wee anecdote. I went yesterday to have my COVID injection. I was in a church hall in Glasgow. The staff there were 40 or 50 of them, and they had spent probably weeks immunising people who had a hard day ahead of them, starting at 8 o'clock, a 12-hour shift. But nevertheless, I felt as if I was an individual within that system. I felt as if they actually cared, they were approachable, friendly, and we need to be able to provide the environment by not only providing a physical environment, but also providing support to our staff so that we can do that. Community wellbeing and psychological health. Ross has touched on some of the impacts of post-COVID on our community health, but also in terms of our physical health, and that crosses over into health inequalities. And as I've said a couple of times already, we can only do this through having a valued, informed and motivated workforce in sufficient numbers in order to be able to deliver those services. So the circle is a continuous circle. So it's not just a point in time. We will produce a document which will be in the public domain, but over the lifetime of that strategy, we will continue to evolve and engage with our public and our staff and be in continuous learning mode. We will continue to learn from what is an optimal service model, as experience shows, not only within Lanarkshire, but beyond the boundaries of Lanarkshire. We need to have the important element, which is leadership and coherent leadership within the work going forward. And that's finite. There is only a certain volume of that planning leadership capability within any organisation. And we need to have a sustainable model for our workforce. And we will do that. This summarises an awful lot of discussion, a lot of work, but effectively, our Health Together will look at the whole population health response under these 4 banners here. Unscheduled care, continue what we started with regard to Operation Flow, the reform piece. Planned care, make sure that when we're having elective activity, we can provide sufficient volume of that, also sufficient quality of that activity. Our mental health endeavours, which Ross has touched on, need to continue. And the biggest element of healthcare is primary care, and within that, general practice. And Suman's given you a very light flavour of some of our ambition with regard to what we want to do moving forward. I'm going to focus on one project which is close to my heart, and I've been working on it for a few years, which is the Mountains Replacement Project. And I often describe this as not a hospital building, but it's a catalyst for service development. And I first of all start off by saying this is an artist's impression, and the number of car parking spaces here will not represent the car parking spaces in the new hospital. The multi-storey car park is missing from this drawing, and quite a few of these grassy areas will in fact have car parking spaces on them, many of which will be electric charging points. So let's just get that one out of the way. The new hospital will be built in Western Moffat Farm, which is just to the east of Airdrie, alongside Western Moffat Golf Club. It's a fantastic situation. It will have excellent transport links, and a brand new road will serve from the north, the south, east and the west. Population will be able to access it. And we've got great hopes that this will in fact deliver quite a lot of change rather than just changing the disposition of the hospital. I'm going to take my second slide first, because the opportunities that a catalyst gives are about replacing an old building, which is quite frankly no longer fit for purpose. It was designed in the 1960s. It was opened in the early 1970s by Jim Callaghan in 1977. We've got an opportunity to provide a 21st century operating environment for staff in that hospital. We're going to provide an awful lot of employment over the course of this. We already are. There are now hundreds of people working on this project, and there will be wealth brought to the local communities within Lanarkshire through our procurement decisions about how we spend our money. And that goes into the supply chain through construction and beyond with regard to how we will support the building of a massive building. It will be, of course, the largest capital building in Scotland during the build phase. That will bring economic growth, and we're very conscious of the opportunity for economic growth as a responsibility as an ARCA organisation within our community, which, as we've already touched on, has a high level of deprivation in North Lanarkshire, but also that economic growth will have opportunity across the whole of Lanarkshire and the Central Belt. Some of you may have seen the educational opportunities that we've already developed through linking with schools and the apprenticeship programmes which our main contractor, Legal O'Rourke, will bring to the project, will give employment and developmental opportunities for the young people in Lanarkshire. Just go back a slide. So where are we? The outline business case effectively is the case to government to say this is our cost estimate, this is our programme estimate, this is the scope of what we hope to achieve strategically in terms of service delivery. And that was approved in July. It was a big step forward for the project because it meant that we could do two things. We could submit a planning application to North Lanarkshire Council, and that's now in the system and will come to fruition in the spring. And we can appoint a construction partner, and that was Legal O'Rourke, a company who have massive experience in building hospitals across the United Kingdom, including Forth Valley and Dumfries and Galloway. Next stage is the full business case, the FBC, which will effectively say we have designed, we have costed, we have tendered, we now have an absolute programme, we're quote shovel ready. Can we have the go ahead? And we expect that to be in the decision tree by the end of 2024 into perhaps the early part of 2025. But we can't wait until that point in terms of changing our clinical model and the opportunity, the catalyst that this hospital gives us is now in train. And there are ways in which we're now working as a system which are different to what we would have been if we had not been building this hospital. Some of that is about unscheduled care, some of it is about planned care and the way in which we run our operating theatres, for instance. And I've already touched on the employment economic opportunities, which are real and live now within our community. And as I say, we hope to complete the hospital in the summer of 2031. I think that's me.
Thanks very much. I'm sure nobody in this room will have escaped their notice that the Scottish Government's decision around the new configuration of neonatal intensive care services across Scotland will impact on services in Lanarkshire. And so one of the questions which was posed clearly was around the University Hospital Wishaw neonatal services. They're changing. Why is this happening? And so I'm going to invite Chris Dagan, Dr. Chris Dagan, who's the Executive Medical Director, to talk to us. Chris.
Thanks, Chair. Good afternoon. So this has its origins in the Best Start programme, which was published in 2017. And one of the major tenets of the Best Start programme was the aim to improve outcomes for very low birth weight and very premature babies on the basis that clinical evidence noted that if you focus and increase expertise in a small number of highly specialised units, then you improve the outcome for these very vulnerable neonates. So work was undertaken to progress this recommendation, and outcomes of this recommendation were published in the summer of this year. And the output of this recommended that a number of neonatal units in Scotland is reduced from its current number down to 3 in Scotland. And those 3 neonatal units were based at the QEUH in Glasgow, the Royal Infirmary in Edinburgh, and Aberdeen Royal Infirmary. And these 3 units were chosen because of their size, because of the number of neonates that would co-locate there, which would be at the number that is known and recognised to increase outcome for these very particularly vulnerable babies, and along with the choice of Aberdeen, which was chosen for specific geographical locations. And this built on pilot work that had already taken place, where neonatal units in Fife had co-located to Lothian, and neonatal units in Ayrshire and Arden had co-located to Glasgow. As a result of these recommendations, clearly this raised a number of concerns for NHS Lanarkshire. And it's fair to say that we were disappointed that there was a plan to reduce to only 3 units in Scotland, and we're disappointed that there would be an impact for NHS Lanarkshire. A number of concerns really arise as a result of that. These include the risk in us maintaining our services. We have a high quality, award-winning unit with experienced staff, and therefore a real concern for us is to maintain the staff that we have, the high quality and excellent staff that we have, in order to maintain a service within University Hospital Wishaw. We have concerns about removing the service within Lanarkshire and the inability to maintain this service close to the community, and the risks that mothers, babies, families may need to travel significant distances. So we continue to actively engage and influence on a national basis, a regional basis, and a local basis, and we have met our neonatal teams on a number of occasions. We will be working with the regional implementation group so that we can continue to provide the highest standard of neonatal care to babies and families in Lanarkshire, and we will continue to work on this issue with their interests at heart.
Thanks very much. Our work to make sure that we properly represent the concerns and make sure that we get full understanding of the issues will continue. Just 2 contributions left before we open it up. And first of all, I'd like to ask our relatively new employee director, Sylvia Stewart, to talk about the points of priority or concern from the staff. Sylvia.
Hi folks, my name's Sylvia Stewart. As has been said, I'm the newly elected employee director. I have been employed with NHS Lanarkshire for 23 years as a biomedical scientist. I've been a trade unionist and activist for 10 years, and I've worked alongside my staff side colleagues for probably the best part of those 10 years. I'm absolutely delighted and honoured to be the new employee director, and I want to work in partnership with NHS Lanarkshire to address issues that staff side have. So far, it's been quite an easy ride. There have been a couple of issues, but we have resolved them with NHS Lanarkshire, not a problem at all. We want to be heavily involved with strategic planning, operational planning, organisational changes, business cases, and the MRP, which is quite exciting for a lot of staff. We want to ensure that there is involvement in all things NHS Lanarkshire. We want to ensure there is engagement and there is consultation with staff across the piece. We want to ensure that there is collaborative working, and I'm really keen to ensure that the working relationship that we currently have is built on and improved. There have been things happened in the past, good, not so good, but hopefully staff side will build on that with our new chief exec and our new HR director. And so we've got a new wee group, and hopefully working, being so close in Caplan's to everybody, and we can engage fully. And I think staff side are pleased that there's been a change, and hopefully moving forward, exciting things to come, especially with MRP. So thank you, and thanks for the welcome to NHS Lanarkshire.
Thanks, Sylvia. Our last presenter this afternoon is Maureen Lee's professional lead for dietetics, but she's also chair of the area clinical forum, and it's really important that the board receives the advice of the wider clinical body across the organisation, and that's one of the hats that Maureen wears, and she's going to talk to that now. Maureen.
Thanks very much. So I'm Maureen Lees, and as Martin said, I work for NHS Lanarkshire. I work in the dietetic department, but I am also chair of the area clinical forum. So I'm the other side of Sylvia's coin, really. So where it's Sylvia's role and responsibility to look out for staff in terms of what we're doing here in the board. It's the area clinical forum's role to look out for patients in clinical care and any things that we are bringing through. So I hope it came across today that the board are really keen to get information about services and to hear how it impacts on people. So we have this advisory structure within the board, and that's made up of 8 professional groups, and those professional groups are HPs like myself, so physios and OTs and dietitians, nurses and midwives, obviously, who the majority of our staff, doctors and dentists, opticians, pharmacists, healthcare scientists like Sylvia, and psychologists. So these groups are represented on what's called the Area Clinical Forum, and they've got two seats on each. And I'm the chair of the forum, and because I'm the chair of the forum, I'm also a non-executive on the board. So that's where I fit in. And the role of the forum really is to provide this independent clinical advice to the board on all the things that you saw earlier. So roundabout workforce, roundabout operational, roundabout the MRP. So all of that coming through and then hearing independently from staff. So it's really to reassure the public that the executives in this board don't get it all their own way. That's the role of the non-execs here. It's to make sure that there are checks and balances and that things just don't get run through. We'll hear from staff through Sylvia's. You'll hear in terms of how they feel about their work. You'll hear about staff in terms of how they feel it's affecting patients. And it's to give you that assurance that that's what we're doing in the board, and that if you have concerns as members of staff, that there are a way to get those concerns heard and on the board. I think that's all.
Thanks very much, Maureen. Thank you. That's a lot of information to throw out at you. I hope you found it of interest. We invited any questions to be sent in advance, and as you've heard, we've addressed the questions that were sent in. If after what you've heard this afternoon, or after you go away and watch the recording, there are other issues, questions or comments you want to submit, then please do so. We would like feedback, okay? So please contact Chief Executive's office with any comments or questions, and we will provide answers.